Hello, I'm Dr. Kate Carr. I'm a medical aesthetic doctor working from my clinic, which is based in an area called Cockfosters, which is in North London. And today I'm going to be speaking to you about the amazing products from Deves Med, concentrating on their Hydra Royal range. These are a fantastic collection of products which are going to improve skin quality in a natural, beautiful way. A little bit about my background. I graduated as a medical doctor back in 2003 from the University of Sheffield and first began my aesthetic career back in 2008. And I now no longer work as a general practitioner and spend all my time working full-time in my aesthetic clinic in North London. So I'm just going to go very briefly through the importance of when we're consulting patients, doing a really thorough consultation, because this is what's going to set you apart from other clinics when you are assessing your patients properly and educating them and getting them to understand how tissue stimulators are going to help them and help keep them looking natural and achieving beautiful results. So when I see a new client, I will set aside up to 50 minutes to do a really in-depth consultation. And it's important, to find out about your client. You want to know a little bit about their lifestyle, what's brought them there today. You want to find out about their medical history, drug history, allergies, and not just allergies to drugs. It's important to find out about all allergies so that you can properly assess their suitability for these treatments. And then find out, have they had aesthetic treatments before? I think common phrases that I frequently hear in clinic are that clients are absolutely petrified about looking weird, they're worried about looking fake, and people are very nervous about fillers, and a lot of the clients that you see will be very clueless about aesthetic treatments. An injectable is just an injectable, and they don't understand the difference between fillers and tissue stimulators. So it's our job to educate them so they understand what tissue stimulators are and how they're going to provide them with lovely, natural, long-lasting results, and it's not going to make them look weird or strange. So the tissue stimulators are really having their moment in the aesthetic world now. When I first started working in aesthetics, we literally had toxin and fillers, and there wasn't really much else. But I would say over the last couple of years, tissue stimulators have really started to gain popularity, and practitioners and patients to some extent are starting to understand the importance of looking after their skin and really investing in their skin, because this is how they're going to have beautiful, long-lasting, natural results. Also, it's important to use these treatments in combination with other treatments. So fillers and toxins still have their place, but if you can get them onto good quality tissue stimulators, they're going to look natural, they're going to look better, and they're going to get better results from their other aesthetic treatments. So it really is important to educate our patients. And not all tissue stimulators are created equal. So we're going to be focusing on the amazing Hydra Royal range, and this is a 3-step process. Just the fact that there's 3 stages sets us apart from other injectable treatments, such as your normal skin boosters. So what are tissue stimulators? So it's a general term for products that we're either applying to the skin or injecting into the skin, and your body is responding to the treatment to bring about a positive change. So they are going to stimulate collagen and elastin. They're going to improve the hydration of the skin. They're going to reduce inflammation. They're going to improve the quality and the health of the skin, and they're going to slow down the aging process in a very natural, beautiful way. So just looking at the physiology, the effects that they have on the skin. So we're going to be helping to provide the building blocks so that we can form new collagen. We're going to be stimulating our fibroblast cells so that they can produce more collagen. We are having an effect on lots of different levels of the skin. to really slow down the aging process and improve the skin quality. So they can be grouped into biorevitalizers. So this would be our hyaluronic acid, and this would include the high molecular and low molecular weight hyaluronic acid. We have the stimulators. So under the stimulator category would be our collagen, our amino acids, our hybrid complexes of hyaluronic acid, poly-L-lactic acid, and therapies such as plasma or fibrin. And then we've got the biorestructurers. This is things like our fragmented hyaluronic acid, polynucleotides, exosomes, and Plasma Royal falls into this category. So hyaluronic acid, we have low molecular weight hyaluronic acid and high molecular weight hyaluronic acid, and they both complement one another. So your low molecular weight hyaluronic acid is going to really help to fill those intracellular spaces and improve the hydration and the quality of the extracellular matrix. So this is going to help our cells to behave optimally. We then have our high molecular weight hyaluronic acid, which is going to help prevent that transepidermal water loss, and this is going to help to smooth and tighten the skin. So these two different forms of hyaluronic acid complement one another. We then have something called fragmented hyaluronic acid. So this is something that is incorporated into the Hydra Royal range. When we have fragmented hyaluronic acid, it's behaving in a different way to the low molecular weight and the high molecular weight hyaluronic acid. It is having an effect on the CD44 receptors on those fibroblast cells, and the fibroblast cells are what is producing our collagen and elastin. So this is a really important aspect of the treatment. And when we are talking about our clients, if we can just educate them a little bit, we're not trying to confuse them, but just make them understand why we've selected this particular treatment for their particular concern, they will really feel that you care about them and you're doing your utmost best to get them the best possible results. And this is how you get loyal clients who keep returning to you time and time again. So this is a 3-step treatment that I'll be going through. And as I say, it's very unique because most skin booster treatments, tissue stimulator treatments, just involve one injectable. So the fact that this is a 3-step process that you can make bespoke to the individual will really set you apart from other tissue stimulator treatments that are offered elsewhere. So we have step 1, which is the Hydra Royal peel. This is a combination of 4 different acids. It's a very, very gentle peel. It's going to be suitable for pretty much everyone, except people who have a medical contraindication or who are allergic to any of the ingredients. But for the majority of people, even those with sensitive skin, rosacea, they're going to be suitable for the Hydra Royal peel. So we're just going to look at some of the ingredients. We have the lactic acid in there. This is a very, very gentle acid. It's going to help to break down those bonds in between the old damaged skin cells and help them to shed them more quickly. So this immediately is going to give a lovely improvement in the texture of the skin. Lactic acid also helps to improve the moisture levels within the skin. And we also have citric acid in there, which is going to improve the acidity of the skin. It's going to help brighten. We have ferulic acid, which is a powerful antioxidant. And finally, we have the tranexamic acid, which is fantastic for improving pigmentation. So the combination of these 4 different acids is going to be a really great starting point, and we'll be going through the technique. So this is your peel. Another thing just to consider when clients are coming in, it's very common for clients just to come in and asking for a face treatment. But really, if we are treating the face, we also want to think about treating the neck, the décolletage, and the hands. And this is something we should be discussing with patients, because sometimes, particularly if people are new to aesthetics, they don't realise that they can have these treatments on other areas. And one thing I tend to say to my clients is you don't want your face to be in one decade and your neck and decolletage to be in another. So it's really important to, think about the whole patient. And then step 2, we have our Hydra Royal skin booster treatment. So this has a really high concentration of hyaluronic acid, and it's very long lasting, and we'll be looking at that in some more detail in a little bit. And then we also have the Hydra Royal booster, which can be used alongside the injectable treatment. And finally, we have the final step, which is this amazing gold collagen mask, which will help to calm down the skin, relax the patient at the end, and really improve, how the patient's going to look as they leave your clinic, which is very important. Okay, so I'm just going to be looking at the different stages. So as mentioned, the peel, it's pretty much suitable for almost all skin types. It's not going to irritate the skin. It's going to improve the hydration. It's so gentle that it can in fact be used on the eyelids. It's also a great treatment to give that Cinderella effect. So if you had a client who had an event, a big party, you could do the peel the day before and they're going to have beautiful glowing skin. It's also suitable for clients with rosacea. And this is the peel here. So with this, you've got 5 mils, and you can, just treat the face, but why not treat the neck and the decolletage, or the neck and the hands? Really, think about the whole area. The next step with the peels, so really important to obviously check that they're suitable. We're going to be cleansing their skin. Ideally, if patients can come without makeup, it makes life much easier. We're going to cleanse their skin, and then it's really, really important to spend time degreasing the skin. This is a really, really important step when we're doing a peel. If you don't degrease the skin properly, you're not going to get even penetration of the peel. So never miss this step out and really spend time degreasing the skin. Then if we were just going to treat the face, we would use 1.5 mils of the peel. You're going to apply the product to the skin, and you're going to massage it in a really firm lifting action. So this is going to add to the whole experience of the treatment. And then we would leave this on the skin for anywhere between 8 to 15 minutes. This peel doesn't, when you're removing it, you just remove it with water. It doesn't need neutralizing with anything else. So it's very straightforward peel to do, but really going to help elevate the results from this treatment. Next up, we've got the Hydra Royal. So this is the injectable tissue stimulator treatment. So in this box, you've got 3 1 mil syringes. Now, what sets this apart from other skin booster treatments? This has a very high concentration of hyaluronic acid. You have 20 milligrams per 1 mil. And you have options. So we've got 3 syringes in here. So you may choose to treat, someone's face, neck, decolletage, or if someone, perhaps is more mature, sun damaged, lots of wrinkles, very dehydrated skin, you may choose to use all 3 mils on their face. You've got a lot of flexibility with this treatment, okay? And the other thing to bear in mind, the Hydra Royal injectable has a very, very low amount of the cross-linking agent BDDE that we see in fillers. But the amount is so low that this can't be classed as a filler. But what it means is, because it's got that small amount of cross-linking in there, it's going to stick around for a long time. And this is really important when we are having a tissue stimulator treatment. The longer that it's around, the better the results our client is going to get. Then we also have the option of adding in the Hydra Royal booster. And again, you may choose to just treat the face, but why not treat the face, neck, decolletage, or the hands too? So you have 5 mils in here, and there are different protocols which we'll go through as to how you can combine these 2 treatments. With the Hydra Royal, this is a combination of amino acids, and we've got that fragmented hyaluronic acid that we mentioned earlier, where it's going to stimulate those CD44 receptors on the fibroblasts and really help with increasing the collagen stimulation. And then last but not least, we've obviously got the face mask. So with the booster, as mentioned, we have the amino acids, the fragmented hyaluronic acid, but we also have vitamin C and glutathione in the booster. So the vitamin C and glutathione are going to help brighten. They are also very powerful antioxidants, so they're going to improve the skin health and just help to slow down that aging process. So when we're doing the Hydra Royal injectable treatment, as mentioned, there are different ways of administering this. So we may choose to just do micro deposits. So you would treat the whole face, you can treat the neck, just doing tiny little blebs under the skin, but you don't want to put this too superficially. This is going into the dermis. So that's one technique. You may, after speaking to your client, because you found out all about them, what they do for a job, do they work from home, is bruising going to be a problem, you may choose to use a cannula, because if bruising is going to be an issue, you do have the option of administering this with a cannula. This is why it is really important to find out all about your clients and what's going to fit in with their lifestyle. You also have the option of doing this in 5 key points on each side of the face, so it would be 10 injection points in total, and we will look at those points in more detail later. And then you can also do the combined technique, so you may decide to do the 10 injection points on the face using 2 mils of the product, and then with your remaining 1 mil you could actually mix it with the booster and then do the microbolus technique. So there are lots of options. With the protocols, we can do 1 mil for the face, 1 mil for the neck, and 1 mil for the décolletage. And then with our booster, we may choose to do 3 mils on the face, 1 mil in the neck, and 1 mil in the décolletage. So I'm just going to go through a few of the different techniques. So we could do the 1 mil in the 5-point lift, but you're actually going to be using a total of 2, because 1 mil on each side of the face. And the points would be here, 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 and here. And then for the advanced version, we would combine our last mil with the booster. And then you could choose either to administer that with a cannula if bruising was of a concern, or you may want to do that with a needle in little micro deposits. We also have the option of just targeting a few key areas. So it may be that someone has been having, other treatments and their skin's actually in quite good quality, or they just want to focus, say, maybe under the eye area or the perioral lines. So we have the option of just focusing on those areas. So you may just combine 1 syringe of this with some of your Hydra Booster Royale 1 mil, and just do it in a micro bolus technique around these areas and around the eye area. Again, you may choose to use a cannula for that.
Yeah.
Then your Hydra Royal mask, as I say, this is a really nice end to the treatment. It is ideal if you could put this in the fridge for ideally 2 hours beforehand. It will make it much easier to apply. And also after someone's had the peel and they've had the injectables, it's quite a nice way of just calming down the skin and cooling it down. It's going to improve the hydration of the skin, reduce the redness. We all want our clients walking out our clinic looking the best, possible way they can. And it's a really nice way to end the treatment. So you can also use this not just after this treatment, but you can use this after lots of other aesthetic treatments as well. So the mask is suitable to be used after microneedling, after lasers, fillers, and other invasive treatments. So who is suitable for this treatment? So this treatment really is suitable for a whole host of clients. It's going to help improve the hydration of their skin. It's going to slow down the aging process. It's going to help reduce the appearance of lines and wrinkles. It's going to help target photo aging, sun damage. Can also be used to help improve the hydration in the lips. Great for those people who don't want filler, but they just want a little plump, gentle plump in the lip area. So we're going to be boosting the levels of hyaluronic acid within the skin. Hyaluronic acid is a water molecule that we naturally have within our skin, but unfortunately, as we age, these levels deplete. So if we can improve the moisture levels within the skin, our lines and wrinkles are going to look better, and we're going to have a refreshed appearance, and our skin is going to be in better health. So it's going to help with dryness, going to improve the texture of the skin. When our skin has a better texture and it's better moisturised, our makeup is going to sit better. We are also going to improve the tone of the skin and just the general health and slow down the aging process. So just in summary, I think tissue stimulators really are continuing to gain popularity, but it is important to really educate our patients about how tissue stimulators are not fillers. Also, one thing just to bear in mind, if you have clients who have only ever had fillers and they're no longer getting the results that they want from the fillers, or they've sort of come to a point where they really don't need any more filler, it is important to educate them about how tissue stimulators are really going to help to help the filler to last longer, but really slow down that aging process and help to keep them looking natural. And then you'll have the other group of clients who are petrified about having fillers, and they may not need fillers if we can improve their skin health and slow down the aging process. Thank you for listening, and we'll be going through the treatments very soon. So we have our beautiful model here, and after a thorough consultation we have decided on the Hydra Royal 3-step tissue stimulating treatment, and I'm going to be showing you one of the protocols, but as mentioned earlier, there are lots of different protocols, so you really can adapt this treatment and make it bespoke to your client as an individual. So we're going to start off by cleansing. So we're going to be using the Amazing Power Cleansing Milk. Ideally, if we can ask clients to come without makeup, it does make our lives much easier, but it's not a problem if they do. It just means you need to spend that bit more time cleansing. So we're just going to remove the cleansing milk. And then we're going to follow using the Hydra Toner from Deves Med. These are amazing products to have on your back bar. And in the presentation, as mentioned, this isn't just your normal tissue stimulator skin booster treatment. Because this is a 3-step protocol, it really does feel like a luxury royal experience, and that is really going to help set you apart from other clinics. So when we're doing a peel, it's really, really important to thoroughly degrease the skin. So you can either use the degreaser, or today we're just going to be using alcohol wipes. Degreasing is a really, really important step, because when we're applying peels, so a combination of acids to the skin, if you haven't removed all that grease, you're going to find that the peel isn't going to penetrate evenly. So really important to spend your time degreasing. That's going to make your peel more effective and get you the best possible results. So a little bit fumy from the alcohol. Just going to really, and you want to apply quite firm pressure, just making sure that you're really getting rid of all that oil on the skin. Fantastic. And today we've opted just to treat the face, but we could, have decided that we were going to treat the face, the neck, the décolletage, even the hands. It is great when, people pay attention to those areas as well, but today we've decided just to focus on the face. So we're going to get our Hydra Royal peel. Make sure that you've got the right bottle. So the peel is in this brown golden bottle. And for the face, we're going to use 2 mils. So we're just going to withdraw 2 mils. And this peel is pretty much suitable for anyone. Obviously, if someone had an allergy to one of the ingredients, we wouldn't use it, or if there was a medical contraindication, but it is such a gentle yet effective peel that you can use it on even people with rosacea, people with sensitive skin. It's going to do a number of things, but it's going to brighten, it's going to hydrate, it's going to help get rid of those old damaged skin cells that are clinging onto the skin, and it means that when we do the next 2 steps, they're going to be even more effective because the ingredients are going to penetrate into the skin better. And also, we want our clients to leave the clinic looking amazing. We want them to wake up the next day looking amazing. By adding in this step, it's really going to help us to achieve that. This is also a fantastic peel to do as a red carpet treatment. So if someone had a big event, and they wanted amazing skin for the night of the event, you could do this peel the day before, and the makeup's going to sit on beautifully and they're going to have glowing skin. So you can also do it as a one-off. Okay, so we're just going to start applying the peel. So I've got my 2 mils. There are different ways of doing this, but I like to just put little bits into my hand, and we're going to apply it, and we're going to rub quite vigorously in an upward motion. But this is such a gentle peel that you can even use it on people's eyelids, which is quite unique. And it's a combination. So in this peel, we've got lactic acid. Lactic acid is fantastic for getting rid of those old damaged skin cells. So it's going to improve the texture and the tone. It's also got really good moisturizing properties, but also gentle. We've also got our citric acid in there. The citric acid is going to help to regulate the pH of the skin. It's going to help to brighten. We've also got our ferulic acid in there, a powerful antioxidant. And we also have tranexamic acid. So tranexamic acid is fantastic for helping to target the pigmentation. So really going to help, again, improve the texture and the tone. And okay there? Yeah, people tend to find it very comfortable peel. So we're just massaging it in, quite a firm motion. And then we would leave this peel anywhere from 8 to 15 minutes on the skin. Okay, so that's my 2 mils, and I'm just going to give it a nice firm massage. And this part is quite a pleasant experience, so it just adds to the whole luxury experience. Little bits under the brow bone. You can come quite close to the lash line there. Fantastic. So we're going to leave that on for 8 minutes. So our 8 minutes have passed, so we're now going to remove this peel. This peel just needs to be removed with water. We don't need to use any other neutralising for the peel. It's a very nice straightforward peel to do. So we're just going to remove it with water. And depending on your client's preference, you could have already pre-numbed the client. You could have applied numbing cream prior to the peel, because obviously we are going to be doing some injectables, but not all clients feel the need for numbing cream. So we're just making sure that it's all thoroughly removed. How's that feeling? Don't feel like I've missed anywhere. Perfect. Okay. So we've done the first step, which is the peel. So now we're going to move on to the injectable step. So we're going to be sterilising the skin. I like to use Clinisept, but any suitable skin steriliser. And we're going to start off with our Hydra Royal tissue stimulator. So we're actually, for this particular client, we're going to be using, to start off with, 2 mils, 1 mil on each side of the face, and we're going to be injecting 5 points on each side, and I'll show you when I'm marking up for that. So with the Clinisept, we're just going to sterilise all the skin. Okay, so we've sterilised the skin. And then we're going to do, as I said, 5 points on each side. So for this patient, we're going to be injecting here and here. We want to leave about 2 centimetres from the lateral canthus, and we're going to be injecting 0.2 mils on each side. We're also going to be injecting here, 0.2 mils. We're going to be injecting here, here, and here. And from those points, it's going to give a lovely lifting and hydrating effect and spread under the skin. So we're going to be using a 30 gauge needle, and we want to go into the dermis. Okay, so we're going to just start on this side here. Are you comfortable there? You're doing well. So we've just done our first point, and we've injected 0.2 mils. Compared to some other tissue stimulators, clients tend to find this quite a comfortable injection. The extrusion force isn't too much, so they tend to find it's quite comfortable. Okay, so we're just going to come into the mid-cheek. Our final point just here. Fantastic. It's very easy to inject, very smooth. With the injection points, it's important that we stay within the mid-dermis. So as a guide, when you're injecting, you shouldn't be able to see the colour of your needle, because you should be deep enough that you can't see, but if you were to sort of just lift up gently, you could just see the outline. And we've raised very, very tiny little blebs, but most of them you can't see. So we're going to move around, and we're going to do exactly the same on the other side. Really important for documentation purposes, you need to be keeping all your batch numbers and recording those in your patient notes. If someone had decided that they wanted a face, neck and décolletage treated. You could have just done 1 ml on the face, but as mentioned, this lady, we've decided to really focus on her face. We're not treating the other areas today, and hence why we're using all 3 mils in the face. So we're going to do the same on this side, so 2 centimetres from our lateral canthus. Injecting here at the angle of the jaw. I'm going to do the mid cheek. If you imagine drawing a line from the mid pupil downwards. .2 mils per injection site. Last injection here in the chin. Fantastic. So the next step, we are actually going to do a combination. So we've got 1 ml remaining of our Hydra Royal, and we're actually going to mix it with the booster. So this is our last remaining 1 ml, and we're going to take 1 ml of the booster. So first of all, we're going to put this into a 5 ml syringe. And this is our connector. So we're going to decant into So we're going to be using 1 ml of our booster, but as mentioned, you really can make this treatment bespoke to the individual. This is just one of the protocols we've decided that's right for our patient today. Get rid of any air bubbles. Okay, then we want to pop this into a 5 ml syringe. So we've just got our 1 ml of the Hydra Royal booster. We're going to decant it into the 5 ml syringe. If you're not used to mixing and decanting products, really important to just pay attention to the size of the syringe that you're using. It is so easy to go with your bigger syringe and your smaller syringe and try and start your mixing, and you'll just end up with product everywhere. So make sure that you're using the right size syringes. So we're just going to remove that. So we have the Hydra Royal booster in here. We've got 1 ml, and we're going to connect this to our 1 ml of the Hydra Royal, which is the slightly thicker gel. And just want to make sure that they're connected properly, so they don't go flying off. And then we are just going to mix the products. So just go slowly to start with, just so you're sure that they're connected properly. I would normally recommend doing this around 30 times reasonably quickly, just to make sure that it's properly mixed and nice and uniform. So this is going to give us 2 mils that we're going to treat the whole face with. It's fantastic to be able to deliver a tissue stimulator treatment where we're also able to include the forehead. And again, you know, there's different techniques. So if we had a client who, you know, wanted the treatment, but bruising, downtime was going to be an issue for them, you know, you have the option, we could administer this with a cannula. Okay, so we've got our 2 ml here. And I like to decant back into the 1 ml because I just find I've got more control when I'm administering the product. So just going to put on our connector. Make sure everything's secure, and we're just going to withdraw 1 ml. Just be careful not to push too hard on the plunger of the bigger syringe, or it will go flying off everywhere. So we've got our 1 ml, and this is going to be for half of the face. And we're going to use a small 30 gauge needle. And you can, you know, if you want to, it's perfectly fine to draw a grid over the whole face, like little squares is quite a nice way of doing it. And then you're just going to be doing little equal blebs. So we've already sterilized the skin, so we're going to start. You can start top or bottom. I quite like to start on this area and work up. So we just want to go superficially, but still not too superficial, still into the dermis. And we're just doing tiny little deposits, approximately 0.05. You may, after assessing your patient, decide that there's certain areas that you'd like to focus on. It might be that you want to focus in the nose to mouth lines, or it may be, you know, around the crow's feet. You really do have a lot of flexibility with this treatment, but we just want, we decided to just do nice even spacing. A little bit pinchy here, well done. Doing really well. As mentioned, you could use a cannula, but I do think it is nice when you're doing the needle, because they're also getting, you know, the benefit of a little bit of microneedling. Doing really well. A little bit here around the crow's feet. A little bit into the temples. Remaining quite superficial, particularly around the forehead. Well done, lovely. This will help to soften those static lines on the forehead. Well done. Just going to do the chin, a little bit in the marionettes here. Find it's nice once you've treated the whole face, you can then just go back with any remaining product and just focus on areas that you feel need a little bit more attention. Well done. Fantastic. I've just got a little bit of product left, and I'm just going to come into the nose to mouth lines. Fantastic. Fantastic. So that's half our face done, and we're going to do the same on the other side. Always a good idea, just if there's any areas that are bleeding, just apply some firm pressure. You're going to reduce the chances of having a significant bruise. So we're going to draw up the last 1 mil. And another variation, you may have decided to, you know, if you were treating the face, the neck, the décolletage, you may have decided to use 2 mils on the face, and then 1 mil on the neck, 1 mil on the décolletage. Lots of options with this treatment. I'm going to get a fresh needle. You don't want to be injecting with a blunt needle because it adds to the discomfort. So we've got our 30 gauge needle. Just make sure we've got no air bubbles. Fantastic. So we're going to do the same on this side. Most clients tend not to find this too uncomfortable. It's quite a quick treatment. For pain relief, as mentioned, we could opt to numb the client beforehand. Other things, if you do have patients who are quite nervous or you're worried about their pain tolerance, you can give them a squeezy ball. That's quite a good distraction. And we can also use the little gold vibrating tools, and I just tend to get clients to hold it. The vibrations just help reduce the discomfort from the needle. They find that it's not so sharp. Going to also tap on the skin over some of the more sensitive areas. A little bit close to the orbital rim. You could also use this product, we haven't today, but on the top lip area. It's often an area that patients want treated. A little bit into the crow's feet, the temples. Really well. Just focusing on some of these static lines on the forehead. Do the chin. And then our last little bit of remaining product, we're just going to come into the nose to mouth lines. Well done, lovely. Our model opted not for numbing cream. Well done. Last little bit. Fantastic. So that's all our injectable treatment done. Then at this stage, I do like to just again sterilise the skin with Clinisept. So then the final step, we're going to go in with our Hydra Royal mask. The Hydra Royal mask is going to really help to calm down the skin. It's going to help to reduce the redness. It's going to hydrate. It's a nice relaxing part at the end of the treatment, and it's just going to help the skin to recover quicker. The Hydra Royal mask can also be used after other aesthetic treatments, such as after microneedling, lasering. Great if you've got a fridge. You can put it in the fridge for at least 2 hours beforehand, then it's really nice, cool, calming on the skin. This is a luxury collagen gold mask. It's got all the pieces cut out. So we're just going to pop on the face mask for you now, lovely. This is going to help to calm down the skin. Fantastic. And I would leave this on for 15 to 20 minutes. So our client has had the beautiful collagen gold mask on for 15 minutes. We're going to remove this. Just another tip, with the mask, there is quite a lot of solution in the bag. So if someone had had a neck treatment or décolletage, you could also apply this. You can also actually soak clean gauze and then put the wet gauze on so that you're covering all the other areas. So they really are getting a lovely thorough treatment. So we're going to remove the mask, and then we're just going to put a little bit of aftercare cream on just to help calm down the skin, followed by our SPF. And always important, you know, to go through the aftercare with clients. So we would not advise wearing makeup or doing any sweaty exercise for the next 24 hours. They should avoid steam room saunas for the next 2 weeks. We would advise against any other invasive facial treatments for the next 2 weeks. Obviously, you know, advise the clients if they had any concerns to get in touch, but it's a very safe treatment for our clients, and schedule their next appointment for a month's time. Thank you for listening to our webinar. We look forward to you joining us on our next one.